Hello everybody, and welcome to the Med-Ace Biostatistics course for medical students. This is the first video in the series. In this video, I am going to introduce you to the importance and relevance of biostatistics and health research in medicine. We are also going to go over the different kinds of health research and the respective objectives. Next, we're going to go over the main elements of a health research project. We will also briefly talk about the role of statistics in health research projects, as well as the concept of making generalizations about populations. And lastly, we're going to talk about errors in health research, their implications, and why it is important to understand how they occur. But before we dive right into these topics, I want to take some time to talk about why biostatistics can be so hard to learn. At least for me, biostatistics was always the most difficult course while in med school. I would watch the class lectures many times, consult the textbook, and look for videos online, and yet I always felt like I was lost. After taking all my board exams, I finally had some time to sit down and think about why biostatistics was always so hard for me. I was able to identify several reasons why biostatistics can be so hard. I want to share these reasons with you in hopes that they can help you identify what you're doing wrong and how to improve your study techniques. The first reason is that biostatistics requires at least a basic understanding of complex statistical topics which I didn't have much experience with. The second reason is that the most effective methods for mastering biostatistics are significantly different than the methods used for studying typical medical school courses such as pathology or microbiology. When I was in med school, the way to study was to watch lectures at 2 times speed, read the relevant first aid pages, and do a couple of relevant practice questions. This technique simply doesn't work for learning biostatistics. The most effective way to learn biostatistics is to do practice problems, go over real-life examples of biostatistics at work, and go over mental concepts multiple times in your head. The final reason is that there is a relative disconnection between how to apply a biostatistics concepts and the purpose of applying said biostatistics concept. For example, the steps in calculating positive and negative predictive value can be very hard to understand and conceptualize. Yet even when you fully understand the steps involved, it is still not obvious as to what are the practical applications of this complicated calculation. In other words, the steps involved in performing the calculation or operation say nothing about the reason for performing the calculation in the first place. This is in contrast to most of the concepts learned in the basic science courses and the clinical science courses, where the steps involved usually tell you a lot about the reason for performing the steps. Given these obstacles when it comes to mastering biostatistics, I intend to address each one by providing abundant examples, breaking down hard-to-understand concepts, and making clear connections between the how and the why. So with that said, let's dive right into it. So why is it important to understand health research and the language of health research, statistics, and numbers? Well, in medicine, it is very important to understand health research findings in order to apply evidence-based medicine. It is important to understand if the findings of a health research study apply to your patients, and in order to do this, you must understand how health research is performed. It is also important for designing and conducting your own health research studies. Health research is how we expand the medical knowledge pool. Regardless of whether you plan to only occasionally read medical literature or dedicate your entire life to medical research, you need a strong understanding of biostatistics and the principles of health research to succeed in medical school and in your board exams. So now that we understand why it is important for health professionals to understand health research, let's talk about why health research is important. There are many ways to generate knowledge. However, only one method of generating knowledge is considered appropriate for making claims about health and medicine. This method is known as the scientific method. The scientific method is considered the most rigorous and accurate way of generating knowledge. Other methods of generating knowledge, such as trial and error and logic reasoning, are not appropriate for making claims about medicine and science in general. So in a nutshell, the objectives of health research are to answer questions about health and medicine in a scientifically sound way. The knowledge gained from answering these research questions can be used to guide healthcare decisions at various levels. So what are some of the most common uses and applications of health research? There are many types of health research projects which can answer an endless number of possible questions, but in general, the most commonly answered questions in health research fall into one of these categories. Health research studies can be used to answer questions about the frequency of health events, such as the frequency of disease or death from disease. Health research can be used to answer questions about the effect of exposure, such as a risk factor or a medication. It can also be used to answer questions about the effectiveness and appropriateness of a diagnostic test, such as the likelihood that a positive result really indicates a presence of disease. It can also be used to answer questions about prognosis, such as survival after a cancer diagnosis. A fifth application of health research that is not included in this slide is to answer questions about the use of healthcare resources, such as the cost of performing a screening test versus the benefit obtained from performing the test in the first place. Such studies are called cost analysis. So now that we've talked about some of the common applications of health research, let's talk about the different categories of health research. Health research projects are generally grouped into 4 categories based on the scale of the questions they aim to answer. These are basic science research, clinical science research, epidemiological research, and health systems research. There is also a 5th type of research category which can be thought as a hybrid between basic science research and clinical science research. This type of research is called translational research, and we will talk about it more in just a minute. Let's go over them one by one. Basic science research is any research which aims to study the basic biologic processes which lead to disease. For example, a study which aims to understand the effect of drug X on liver cell transcription profiles would fall under this category. Clinical science research is any research which aims to study diseases and health at the individual or patient level. For example, a study which aims to understand the effect of drug X on glucose levels in diabetic patients would fall under this category. Epidemiological research involves studying diseases or health processes at the population level. For example, a study which aims to understand the effect of exposure to a suspected carcinogen on cancer risk would fall under this category. Health systems research is any research which aims to study the effect of health systems on the health outcomes of people. For example, a study which aims to understand the effect of health insurance type on health outcomes in diabetic patients would fall under this category. Translational research is a special type of research which focuses on using basic science research to develop new technologies which can be applied to clinical practice. This is the type of research which I said can be thought as a hybrid between basic science research and clinical science research. An example of a translational research project would be a study aimed at using knowledge gained from a basic science study, such as the role of a pathogenic protein in creating disease, and using this knowledge to create a drug that blocks the protein and stops the disease. Lastly, I want to talk about a terminology used oftenly to describe health research. This term is quantitative research. Quantitative research refers to any form of research which makes numerical measurements and uses statistical techniques to make conclusions and predictions. Most types of health research fall under the category of quantitative research. Now let's talk about the basic elements of a health research project. There are many study designs in health research. However, they all share the 5 following elements. Let's go over them one by one. The research question is typically what guides the design of the entire project. It typically specifies the study population, the exposure variable, the control group, and the outcome variable. A common format for developing research questions in health research is the PICO format. The study design or research design is usually picked based on the type of study question and the data being collected. Here are some examples of common research designs used in health research. We're going to talk about all of these in later videos. The sample population is very important. In most studies, it is imperative that the sample population is similar or representative of the entire population being studied. In order to achieve this, most studies use a type of sample called a random sample. We will talk more about random samples in later videos. The study variables are usually defined as part of the study design. There are many types of variables. However, the most important study variables to consider are the exposure variable and the outcome variable. The exposure variable is usually the variable which is believed to be associated with the outcome of interest, or the outcome variable. Lastly, the statistical analysis is the part where the numbers are crunched to determine if the data supports the hypothesis. This is usually where statistics comes in, such as calculating p-values and confidence intervals. In this course, we're going to spend a lot of time talking about the different kinds of statistical analysis used in health research. Okay, so now that we're familiar with all the different kinds of health research and their components, let's talk about the stages of a health research project. Every type of health research project generally follows the 7 stages shown in this figure. The red text indicates the relevant topics that you need to know regarding that specific stage of a research project. We are going to talk about every one of these topics in red, as well as other topics not shown in this diagram. So, let's start with stage 1. Like we said before, the first step of any health research project is to develop the research question or the research hypothesis. We already talked about this, so let's move on to stage 2. The second stage of a health research project is to plan the study design. The type of study design used depends on the type of research question. You will learn that every type of study design has its advantages and disadvantages. Therefore, it is important to choose the right kind of study design for the research question. Other things to consider in this stage is selecting the correct study sample, identifying and avoiding bias, and identifying what kind of variables are going to be used. As you will soon learn, there are many ways to describe variables, and the way that a variable is described has implications on the statistical analysis at the end of the study. We will talk more about this. Let's move on to the next stage. The third stage of a health research project is to conduct the actual study. This step includes performing the literature review, obtaining IRB approval, designing the inclusion and exclusion criteria, as well as many other steps not mentioned here. An important consideration in regards to this step is to identify and avoid possible sources of bias. The fourth step of a health research project is to collect the data. This is a very important step because the way that data is collected can increase or decrease the chance of study errors, also known as bias. We will learn later that health research projects are very prone to errors which can cause the study to make incorrect or inaccurate conclusions. This represents a major problem in health research, and we will talk about it significantly during this course. The fifth stage of a health research project is to interpret the data. This is where statistics comes into play. Depending on the type of study and the type of data, different kinds of statistical analysis can be performed. We are going to spend a lot of time talking about the interpretation of data and the different kinds of statistical analysis used in health research. Here I have listed some of the statistical techniques used during the data interpretation stage of a health research project. We're going to talk about each one of these in depth in the future. Don't worry. The sixth stage of a health research project is to publish the findings. We're not going to spend a lot of time on this step because it is usually not tested as part of medical school curriculums or board exams. The seventh stage of a health research project is applying the findings to clinical practice. This is a very important step because learning to interpret and apply the findings from health literature is one of the main reasons for learning biostatistics as a medical student. We're going to spend a lot of time talking about this in later videos. As we mentioned before, health research studies are categorized based on the types of research questions they answer. However, health research studies are also categorized based on whether the researchers manipulate the exposure or not. As we will soon learn, the exposure is the variable which is studied to see if it leads to an outcome of interest. For example, smoking can be thought as the exposure and lung cancer as the outcome. This brings us to the topic of experimental and observational studies. Observational studies are studies where the researchers do not manipulate the exposure. In other words, they do not deliberately expose participants to the exposure being tested. Examples include case control studies, cohort studies, and cross-sectional studies. On the other hand, in randomized controlled trials, also called experimental studies, the researchers manipulate the exposure. That is, they deliberately expose some of the study participants to the exposure of interest in order to see if they develop the outcome of interest. We're going to perform an in-depth analysis of randomized controlled trials as well as the other major study designs in later videos. Now let's talk about the role of statistics in health research. Most, if not all, health research projects measure numbers. These numbers can be expressed in many different ways, such as means, risk ratios, odds ratios, and probabilities. In order to make conclusions from these numbers, statistical methods must be employed. For example, determining if the results obtained from a study are due to random error or due to a true effect. As we will soon learn, a large part of the reason for using statistics in health research is to determine if the results obtained are due to random error or due to an actual effect. Another important thing to realize is that almost all of the conclusions made from health research studies are expressed in terms of probability. No study ever makes concrete predictions. For example, there isn't a study that says smoking will guarantee lung cancer. Instead, studies say that smoking increased the risk of lung cancer by a certain percentage. This percentage is based on the data obtained from the study. Another important thing to realize is that most health research studies involve obtaining a sample or small group of individuals which is representative of a much larger population. The reason for this is because it is often impossible to study every single individual in the population. Therefore, it is easier to obtain a small group of individuals from the population and then study that group. Conclusions can be made from studying the smaller group or sample, and then these conclusions can be used to make generalizations about the much larger population. However, a consequence of this technique is that errors can arise when the sample is not representative of the population or the sample is representative of the population, but due to chance, the effect being studied is misrepresented by the sample. An easy way to think of this is by imagining you flip a coin 10 times. You would predict that if you flip a coin 10 times, you would get heads 5 times and tails 5 times. This is your hypothesis. However, it is possible that if you do this, you will get a situation in which you get tails 7 times and heads 3 times. So your experiment would end up looking like this. So even though the true probability of getting heads or tails is 50% for each, that is, your hypothesis is correct, due to random chance, your sample, or the 10 coin flips, misrepresented the true effect, or the 50-50 chance. If you saw this, you would probably know better and not assume that for every coin toss there is a 30-70 chance of getting heads or tails respectively. You would probably think that this was due to chance or luck, and if you did it again, you would probably get something closer to 50-50. The problem is that in health research, researchers have no idea if the results were due to luck, as in our coin flipping example, or whether they were due to a real effect or association. This is where statistics comes into play. Researchers can use statistics to calculate the chance that their findings were due to random error or luck. If researchers determine that the chance of obtaining the results from chance alone, or p-value, is very low, then they will assume that the results were not due to chance and more likely due to a real effect. If this seems overwhelming, do not worry. We will talk about this a lot more in future videos. For now, just know that most health research studies involve studying samples which may or may not represent the population of interest. Problems can occur when random error or another type of error called systematic error influence the study findings. Now that we're on the topic of errors, let's talk about the impact that health research errors can have. As you probably already know, most of the healthcare decisions made today are based on findings from health research. This is commonly referred to as evidence-based medicine. Evidence-based medicine has improved the quality of healthcare significantly and is the basis of Western medicine. However, a consequence of using evidence-based medicine is that if the findings of a health research study are incorrect, the quality of healthcare can suffer. Generally, one study is not enough to make changes in clinical practice. However, if many studies are consistently incorrect about the conclusions they make, then this can become a problem. For this reason, it is very important to learn how to avoid these errors when conducting research and how to identify them before applying their conclusions to clinical practice. Generally, all errors in health research projects can be narrowed down to two main types. These are systematic errors, also known as bias, and random error, also known as chance. When a health research project suffers from errors such as bias or random error, it is said to have poor validity. We will talk more about study validity in future videos. For now, just know that errors in health research can have serious consequences in medicine, and for that reason, it is very important to identify and avoid them when conducting research or using research for clinical practice. Okay, so with that, we have come to the end of section 1. We have covered a lot in this video, but you do not need to feel overwhelmed. The purpose of this video was to give you a background as to why health research is relevant and worth learning. In section 2, I will introduce you to the techniques used to pick subjects to include into studies, also known as sampling. As for the take-home points, realize that a basic understanding of biostatistics and the principles of health research is essential for the effective practice of evidence-based medicine. Second, health research is categorized based on the scale of the questions they aim to answer. Third, the basic elements of a health research study are research question, study design, subjects or sample, variables, and data interpretation. Fourth, realize that statistics plays a vital role in helping researchers interpret research data. And last, learning how to identify and prevent health research errors is essential for the safe practice of evidence-based medicine. Thank you for watching and see you next time.